Well, good morning, everyone, and thank you so much for joining us today. I'm just going to share my screen. So excited. This is our second 10:30 call, and we are so glad that you could join us today. So, also in the chat, if you wouldn't mind dropping one thing that you're passionate about other than maternal and infant health. And I'm just going to keep going with my little introduction, if that's okay. So, good morning again. Thank you so much for taking time to join us on our second 10:30 maternal infant health call. When we launched this monthly gathering, our hope was to create more than another meeting. We wanted to really create a space where relationships are built, ideas are exchanged, and people across New Jersey can stay connected to the work of improving maternal and infant health. Last month reminded us just how powerful that can be. The challenges facing mothers, babies, and families are too complex for any one organization, profession, or system to solve alone. And real progress happens when we intentionally bring together community members, advocates, providers, researchers, policymakers, and families to listen, learn, and work alongside one another. And every conversation strengthens our collective ability to create healthier beginnings for every family in New Jersey. And today's conversation is especially fitting because care is more than the services we provide. It is also how we listen, how we build trust, and how we honor lived experience, and how we show up for one another. And so I am delighted to welcome Dr. Kaytura Felix, creator and host of the Deep Care podcast. Through Deep Care, Dr. Felix invites us to think differently about healing, connection, and what it truly means to care for individuals and communities. And I know today's conversation will challenge us, inspire us, and remind us why this work matters. Thank you all for being here, for sharing your expertise, and for being part of the growing community. Together, we're building the relationships, knowledge, and collective leadership needed to strengthen maternal infant health across New Jersey. So with that, it's my pleasure to turn it over to my co-chair, Jill Watnick, to introduce today's amazing speaker.
Thank you so much, Winifred, and thank you everyone for being here and showing up. We really honor your time and hope that you are taking good care of yourself. We want to make no demands on you except to come gather together, sometimes to hold and hear each other. And I can't think of a better way to start that than sharing the bio and introducing a new friend of mine, a colleague of mine, and someone that we are so deeply filled with gratitude that happens to live in New Jersey. I'd like to read the official bio of Dr. Kaytura Felix, MD. She is a spiritual activist in pursuit of health justice. She brings together expertise in medicine, health services, community-based participatory research, and generative leadership coaching to address complex challenges. She is a distinguished scholar at the Johns Hopkins Bloomberg School of Public Health. There, she founded the Black Birthing Futures Project, often titled BBF, a large-scale narrative study on community solutions to the Black maternal health crisis. She is the host and executive producer of the Deep Care documentary style podcast, a guide to helping Black pregnant people thrive through pregnancy and a catalyst system change in Black maternal health. In her free time, she spends time with her sister circle and takes long walks with her family in Trenton, New Jersey, where she lives. On a personal note, you are a leader by example. Thank you for sharing your podcast, which launched this past spring. As we were convening and coming together to write a grant about the New Jersey Midwifery Policy Collaborative, your words were truly in all of our phones, in all of our hearts, and in all of our computer sounds as the work that you were already doing, you were so willing to share with New Jersey. Thank you for sharing your story and your time today. We welcome you, and you're more than welcome to share your screen.
Thank you, everyone, for being here. It is such a pleasure and honor for me. This work is important for me, but to be doing work in my home state, oh, priceless. So thank you so much for the opportunity. So let me start sharing my slides. I have my sound on. Let's see if this works. And we go to present. Can you guys all, is it clear? All right, wonderful. So we have here Black Birthing Futures, Joy, Dignity, and Community. I know we had people put something in the chat. Hold on. Okay, so I would like us to begin. There is wisdom in the room. There's always wisdom in the room. And I would like us to just write, we don't need to write our names because we introduced ourselves, but just insights and lessons we've garnered over the years about improving Black maternal health. So just put in the chat this has been something we've been hearing a lot about for maybe 8, 9, 10 years now, maybe anywhere from 10 to 15 years. And we are people who work in this space, who work with families. We have our own lived experience. So drawing from not just our professional experience, but our personal experience. Yeah, what would you say? And I think there's also people are still coming in, so that is just awesome. All right. So let me just see what we have in the chat. Find new. It doesn't matter where you start. It just matters that you understand the journey, access to knowledge, mental health. That is for sure. Listen to Black mothers. Really listen. Love it, Vicky. It takes a village. Yep. Wonderful. All right. So you may be wondering about me, and Jill read a beautiful bio, wonderful bio. Very kind, very generous. I really enjoyed that. But let me tell you a little bit about myself, right? I am a medical doctor. I am a mother, but I was not prepared for my own pregnancy. Definitely not prepared for my own pregnancy. I wasn't informed about my body. I wasn't prepared. I wasn't supported during my pregnancy or childbirth. And what happened was that I made for a traumatizing birth experience, which really cast a shadow on the first few years of being a parent. And many women experience that. And actually, my mother died 4 months before I was pregnant. And when she discovered that I was pregnant, the first thing she told me was, Kay, are you afraid? Right? So that is what I came into pregnancy with, a lot of fear. And fast forward to the late 2000s, I'm hearing about the dire Black maternal health statistics, but very, very little about solutions. But I'm an immigrant and I was going back and forth, right? So I was living in the States. I had this traumatic birth, but I survived it. But I was going back and forth between the States and Dominica, and I was hearing that women were dying in the States, in the United States, but not in Dominica. And so I just kept on tracking that. And in 2020 to 2023, I started to ask a different kind of question, not a question about why people are dying, but questions about what is the Black community doing to address the Black maternal health crisis, right? So I began to look at the solution. And you know, I spoke with 75 experts, and a couple themes kept coming up. Let me just close that. A couple themes kept coming up. Black community midwives and doulas. a lot of energy around community midwifery. No, I knew about doulas. I knew the work that doulas were doing in the hospital system, but I was really curious about community midwives. Why hadn't I heard about community midwives and what were they doing? So I designed a study to look at that. I traveled to 5 cities in the United States to really do what I call a deep dive around community midwives, to do a 360 degrees. So we interviewed midwives, we surveyed their clients. I observed these midwives. And I'm here to tell you what I learned. So the Black Birthing Future study is the study of community midwifery, and it juxtaposes what the public knows about the Black maternal health, which is the dire statistics, but we focus on the more to the story. So in the Black Birthing Future study, we explore Black midwifery care. And the findings, in a nutshell, the findings affirm that Black community midwives deliver transformative care and care that just not only supports birthing people, but their families and communities. And that is the story that the podcast tells. Okay, so what I found is that Black midwives were providing a kind of care that I had never seen or experienced. And you can imagine, as a trained physician, going into communities and seeing care that I just could not have imagined. Yes, there was the medical aspects to the care, but there was love, there was laughter, there was support of families, there was education, and there was transformation. So the journey we're going to be taking today is what I discovered, a couple of the themes that I discovered during the Black Birthing Future study, and we carry those themes in our podcast. And the themes I'm going to highlight are themes that have to do with joy, dignity, and community. And I believe that these are the themes, these are the values that will transform the Black maternal health crisis, where we will go from death and dying to joy and transformation. So this is the podcast. We have a QR code. You can scan the QR code and you can listen to the podcast on Spotify, on Apple, on NPR One. You can listen, and in the next couple of weeks, you'll be able to find us on YouTube. Okay, so Deep Care is a narrative nonfiction podcast about Black families seeking better births and the Black community midwives offering them a way forward. I narrate it, and in the podcast, we follow 3 midwives and their clients in the South, in Jacksonville, Florida, in Kansas City, Missouri, in LA, and we showcase the unique contributions that midwives are making and what community birth offers Black birthing people. Now, I called it Deep Care because I wanted to signal to anybody listening to this was not run-of-the-mill care. So here's a quick story breakdown of the podcast. The first one is the calling, and here we look at, right? So the first one is the calling, how people come into midwifery. The second episode is guide, friend, auntie, and we really focus on a home prenatal visit. The third is the care never stops, really focus on collaborative care and all the support that Black midwives provide to Black birthing people. The fourth episode is Birth Rebirth, and it is a beauty. It's probably all of them are my favorites, but this one is probably one of my favorites. And here we look at the outcomes of birth. We look at pregnancy loss and miscarriage, but we also look at a live birth. The fifth is Postpartum is Forever, and we dive into the postpartum period, how quiet it gets during the postpartum period, and how midwives and communities can really transform that experience for parents. And the last one, my favorite, The People Can Fly. And it's about the birth and dreams of Black people. All right, so let's talk about our first theme, joy. So what I'd like you to do is in the chat, I'd like you to write down, why is joy important for pregnancy and birth? So don't overthink it, just like, why is it important? So let's see. Joy centers love and wonder. Joy is healing. Absolutely. Direct physical impact on the child's health. Yes, Catherine. Keeps mom and baby healthy, right? Absolutely. Right. So joy is part of the infrastructure we need for people to live and for, and for Black mothers to live. So we know that the systemic inequities rob us from our joy. We know that. I mean, I'm not telling you anything you don't know, but I think it's worth the context around birth in the United States. Joy is very far from that, with Black mothers dying at 3 times the rate of white mothers and Latinx mothers. So here's what the people in our study had to say about what the absence of joy means. That the absence of joy, I believe, is fear. The antithesis is fear, and that the focus on the statistics, the absence of joy, that is scaring people and re-traumatizing them. People are scared to have children, and fear itself leads to worse outcomes. I'm going to repeat that. Fear in and of itself leads to worse outcomes, and that the harmful discourse not only discourages pregnancy, but negatively impacts the pregnancy experience and outcomes. All right.
Come with
Okay.
come with me to my
Okay, so let me share with you what joy looks like in community birthing.
come with me to my first midwife appointment. This is a little bundle of joy. They helped me deliver, so he was nice and healthy and strong.
My name is Kaytura Felix. I'm a trained doctor, a public health researcher, and a mother. I've been studying the Black maternal health crisis in this country and looking for answers. My new podcast, Deep Care, is about a solution that's been hiding in plain sight: Black community midwifery.
Black midwifery is a saving grace to Black mothers. Oh my God, like I've never had this type of care before.
All right, thank you. Were you guys able to hear?
Yes.
Perfect, thank you.
Come with
All right, so then we'll go into dignity. Another important theme in the podcast was the theme of dignity. So now it's your turn. Write down how you bring dignity to pregnancy and birth. I know many of us here have experienced being birth workers. We have experienced being family members. And I think all of us have the opportunity to bring dignity to pregnancy and birth. So just let me hear how you do that. Choice helps. Respecting mother's wishes, listening deeply. Absolutely. Never discounting a mother's feelings. Oh boy, I want to double click on that one. Autonomy. All right. So, so true. So we pregnant people in the United States have a lot of experience experiencing the absence of dignity. I would venture to say that the experience of pregnancy in general robs birthing people of their dignity. So when Black women seek out conventional, mostly hospital-based maternity care, they mention experiencing mistreatment from providers or feel that they weren't listened to, right? Then here's a quote from one of our clients. When we would go to the doctor's appointments to see our OB, they would exclude my husband. He would ask questions and it'd be like kind of disrespectful. Just ignore him or talk straight to me like he's not even there. One of our clients, and we capture that in the podcast. A client wanted to change, switch OBs, and she was not allowed to. That is the height of robbing somebody of their dignity. Barriers to dignity also have to do with access. I mean, we do not put those two things together, but we should, right? One client had to say it's so hard being a Black birthing person, and then even harder being a Black person and you are low income. And so you see the other ways that people talk about the absence of dignity. So here's how midwives, community midwives, support clients' dignities. One client said, meeting my midwife, she had such a warm, inviting spirit, and she's very mothering. So all the appointments with her, it just felt like you're talking to a family member, like helping me let my guard down to let you know this is your safe space. You are okay. Another way of respecting dignity is to respect people's culture and to respect their body. And this client goes on to say that when she was having her baby, in her tradition, and that is actually in episode 4, in her tradition, when the baby is born, they whisper a prayer in the baby's ears, and the midwife supported that practice. Kim's clients often tell her that before midwifery care, they never felt like their medical providers listened to them, that no one cared enough to pay close attention.
And if the provider is not seeing them and attuned to them, how are they going to catch things? How are they going to prevent things?
I love that word, attuned. It suggests something more than the routine checkups or checking of boxes. Having a provider attuned to clients requires deep listening and humility, because clients know their bodies and their lives are anything but simple.
That is where the malfunction is. It's not the woman's body. It's the external experience around her. Because when our bodies are left alone and our bodies are supported, physically, mentally, emotionally, spiritually, and all of that, our bodies work very well. They work very, very, very well. And I see that all the time.
Now, here is a midwife who honors her client's dignity. All right, we'll go to the third theme, community. But before we do go to community, I would like to ask you to write down in the chart, how do you attune? How do you attune to pregnant people? Like, what do you do to attune to them? Just one or two. Yeah. Listening intentionally. Listen, listen, listen. Right? Good. So attuning being not only listening to what's there, but listening to what's not being said. Okay, so let's do with community. The third theme. There are benefits of pregnancy. And what are the benefits of pregnancy? We talk a lot about community. What are the benefits? And I think I just want to say, while you guys are writing, is that, we live in a culture where the focus is not on community as much as on the individual. Not feeling isolated and alone, having the needed support, strengthen the longevity of the family. It is joyful time and should be celebrated in community. All right. So I want to say that community is not just something that's nice to have. It is actually important, critically important. And again, it's another infrastructure of community. So far we've talked about 3 infrastructure: joy, dignity, and community. Biologically, stress changes the body's chemistry. It overburdens the body system with excessive inflammatory hormones. Over time, stress reduces the body's ability to adapt and respond. And I would offer that Black people living in the United States, because of segregation and how our society is structured around racism, discrimination, many Black people enter pregnancy with their bodies already at capacity, their bodies already stressed out. And community is important for a couple of ways. One, the load of pregnancy needs to be distributed among a large number of people. And currently in the United States, that's not happening. That is not happening. We see pregnancy, well, oh, you got problem, you got pregnant, that's your problem. You deal with it. You figure it out. And that is, I believe that is not just a missed opportunity for us, but it's wrong. It's inadequate. So that's one. The other is the opportunity to co-regulate. So as human beings, we co-regulate one another. That is, we can calm or settle each other. Providers and the people around us have a unique position to use that ability for healing. So through making clients feel heard when they voice their concerns, noticing and skillfully addressing their symptoms, providers and other people can ease the life, stress, and anxiety that pregnant people experience. Midwives build community in a couple of ways. They're sending me, right? This client says they're sending me home with a care package. So you're building community with that when you're not only focused on the pregnancy, but you're like, okay, you have enough food to eat? Like, what's going on? What's going on with your family? What's going on with your relationship? Are your children okay? So that's how we build community. And that's how I saw time and time again, midwives building community. So here's an example. Joya, our mom from the top of the episode, was able to follow her midwife, Kimberly Durden's guidance.
She gave me an extra postpartum visit because I told them like I was like I'm not ready. I'm not ready for this to end. She was like, well, do you want to come for like one more? I was like, I can do that. She's like, yeah, we'll schedule you for one more. And she's like, before you start going to the mom's group.
She spent the first couple of weeks in bed, bonding with her baby boy and husband. Then she returned to Kindred Space for her weekly postpartum group visits.
You get to talk with other postpartum moms and dads, and you get to relate on different things. And you realize that you're not in this alone because, like, whatever you may be thinking, like, somebody else is also thinking the same thing or feeling the same thing. So it helps, like, continuously build that community there. And Kimberly is awesome with helping others connect, like in breaking the ice between us, because sometimes we can get a little shy and be scared to talk to each other, but she's great at helping us all come together.
This is amazing because doing this research, like that was a highlight for me. Being able to sit in these community groups, right? These peer groups. And this is how we build community. And it's not just for the mom, these parents take that relationship into the postpartum period and beyond. Okay. I'm going to continue. So here are the next stages of the work. So this podcast is a tool. I encourage you to listen to it. You can listen to it by yourself. But I think it presents a really powerful opportunity to listen in community. So it is a tool for systems change, the kinds of changes we want to see, and what we anticipate, what we want. And the next phase for our work is that we use this podcast, like we have listening circles. So we come together in groups, whether it be within our families, within our community, activists, community advocates, community organizations, within policy circles, within the health provider circles. So we come together and we translate the listening into action. So The podcast will equip families with knowledge and tools to advocate for their care when they go into hospitals or even in the community. It will shift institutional understanding and practice. One of the things we are looking at is using the podcast to educate providers. A midwife reached out to me and says, we can really use the podcast to change OB, medical residents, obstetric residents in terms of how they understand birth and what is possible. We can also use the podcast to strengthen the policy infrastructure that will sustain community-based birth. And I'm hoping like we have these listening circles in New Jersey. So let's start in New Jersey. And I'm really excited about that opportunity. So I want to thank you. I've learned that community midwives in the US are addressing the Black maternal health crisis by protecting clients' dignity, building community, and supporting joyful births, alongside providing what we know and understand as clinical care. I'm going to invite you to connect with us. You can follow us on Black Birthing Futures or on blackbirthingfutures.com on our website. You can also follow me on my Instagram, which is at Kaytura Felix, just my full name. And I have a gift for you. So my gift for you is that we have this research, and it's really research, and the podcast is our love letter to the Black community and beyond. But we also wanted to take the findings and to create a tool. So we created a guide for Black pregnant people, and it's called the Deep Care You Deserve Guide. And so if you would take a picture of this QR code, you can download the guide and you can share, you can download the guide, you can use the guide in your own life. If you want to share it with someone, please share with them the QR code so that they can get their own guide.